Pain in the shoulder blade, shoulder joint, arm and neck can be caused by problems with two small but very important muscles in the human body, the supraspinatus and infraspinatus muscles. Watch this video to the end and learn the causes of this pain, exercises for self-elimination of discomfort at home, and useful recommendations for preventing the recurrence of pain. I am Dr. Chernov. Enjoy watching. The supraspinatus muscle is covered by the trapezius muscle almost along its entire length, and in the area of its attachment by the coracoacromial ligament by the deltoid muscle. It starts from the walls of the supraspinatus fossa of the scapula, fills it entirely, and, narrowing, is directed outward, passing under the acromion of the scapula, attaching to the upper edge of the greater tubercle of the humerus. Tension points or trigger points in the supraspinatus muscle cause pain in the shoulder area and down the upper limb. Trigger points located in the center of the muscle and closer to its medial edge provoke deep and continuous dull pain in the shoulder joint, with the epicenter in the deltoid area, which can go down the arm, concentrate in the area of the lateral condyle of the humerus, and even reach the forearm, passing to the wrist joint. The presence of pain in the elbow joint can serve as a diagnostic distinction from pain caused by trigger points of the infraspinatus muscle. A trigger point located at the lateral edge of the muscle, at the site of attachment of the supraspinatus tendon to the capsule of the shoulder joint, causes pain only in the deltoid area. The pain may increase with forced abduction of the arm and may also be observed at night, disturbing sleep. In severe cases, it is impossible to raise the arm above shoulder level. Some people may experience clicking or cracking in the shoulder area when moving the arm. This happens because the tense supraspinatus muscle interferes with the normal sliding of the humeral head in the shoulder joint. Clicking may completely disappear after eliminating the trigger points. If the supraspinatus muscle is affected only on the side of the leading arm, then in this case, due to the limitation of shoulder abduction in the shoulder joint, there will be problems with combing hair, brushing teeth, shaving. Limited mobility and pain can become a real problem for athletes in training. For example, volleyball and tennis players may have difficulty serving the ball. Trigger points in the supraspinatus muscle can be activated during any acute overload. For example, when carrying heavy suitcases, large boxes, when the arms are lowered down and slightly abducted to the sides, or during a walk with a large dog that constantly pulls on the leash, or during work that requires prolonged raising of the arms, for example, when installing suspended ceilings. Any intense exercises with dumbbells, when the arms are abducted to the sides, or, for example, a barbell press from behind the head can also provoke the activation of triggers and the development of characteristic pain symptoms. The supraspinatus muscle is rarely affected in isolation and is almost always combined with damage to the upper part of the trapezius muscle as well as the infraspinatus muscle. Since the main area of reflected pain from the trigger points of the supraspinatus muscle is projected onto the shoulder joint area, it is also advisable to check the deltoid muscle for trigger points. The pathological process may also involve the latissimus dorsi muscle, which is the antagonist of the supraspinatus muscle, i.e. the muscle that performs the opposite function, adduction of the shoulder. Elimination of trigger points and relief of tension in the latissimus dorsi muscle will increase the angle of shoulder abduction. For independent work with the supraspinatus muscle at home, you can use the technique of mechanical action on the trigger point areas with subsequent muscle stretching. Find the spine of the scapula on your body and the supraspinatus fossa located above it, in which the supraspinatus muscle lies. Then take a small massage ball 8 centimeters and go to the wall. Roll the muscle to the right and left along its fibers for a minute or two, and then, having found the tension zones, exert even stronger mechanical action on them for 30 to 60 seconds. More intense action on the trigger point area can be exerted in the supine position under the weight of your own body, but at first this can be a very painful procedure, especially if you have a large body mass. Be sure to roll the muscle in the same way on the other side of the body. Since the main function of the supraspinatus muscle is to abduct the shoulder in the shoulder joint, it will stretch as much as possible when adducting the shoulder with the arm behind the back. Place your hand on the side of the affected muscle behind your back and lift your hand towards your head. Raise your other hand above your head and stretch your fingers towards each other, trying to make a wrist lock. If the pain is very severe or there is a significant limitation of arm mobility in the shoulder joint, then take a belt, yoga loop, towel, or even a regular sock and grab it, placing your hands as close as possible today. Fix the final position for 1 to 2 minutes. While stretching the muscle, breathe deeply and calmly, and with every 4/5 exhalation, try to bring your hands a little closer to each other. Stretching the supraspinatus muscle at home can also be done under a warm shower. Do the same exercise, directing a stream of warm water to the shoulder blade area. The infraspinatus muscle originates from the entire surface of the infraspinatus fossa of the scapula, leaving the lateral edge and the lower angle of the scapula free. The other end of the infraspinatus muscle is attached by a short tendon to the greater tubercle of the humerus. The initial part of the infraspinatus muscle is covered by the trapezius muscle. The area of attachment to the shoulder is covered by the deltoid muscle. The lower part is covered by the teres major muscle and the latissimus dorsi muscle. Trigger points of the infraspinatus muscle cause pain deep along the anterior surface of the shoulder and deep in the shoulder joint, which goes down the anterolateral surface of the arm, going to the radial surface of the hand, and sometimes spreading to the fingers or to the suboccipital region. A trigger point located in the area of the tendon muscle transition at the vertebral edge of the scapula causes pain in this area. Similar to the reflected pain emanating from trigger points of the rhomboid muscles, and the fourth trigger point located in the middle part of the trapezius muscle. When the infraspinatus muscle is affected by trigger points, complaints may be not only about the pain described above, but also about the inability to reach the back pocket of trousers, button a bra, skirt or dress at the back. When combing hair, shaving or brushing teeth, a sharp pain in the shoulder may occur. If a person is into sports, for example, volleyball or tennis, then in addition to pain in the shoulder, the force of the blow to the ball may decrease. In some cases, the pain does not allow lying not only on the side, on the affected side, but also on the back, since the chest with its own weight activates the trigger points located in the infraspinatus muscle. If a person lies on the healthy side and the arm hangs down in front during sleep, then prolonged stretching of the problematic infraspinatus muscle can also increase pain and discomfort, interfering with proper rest and recovery. Trigger points in the infraspinatus muscle are usually activated by acute stress or multiple stress loads, such as when leaning on a ski pole while skiing. A test can be used to determine whether the supraspinatus muscle is affected, in which the hand is placed behind the back and the opposite shoulder blade is touched. Normally, the fingertips should touch the spine of the shoulder blade or go even further. If the range of motion is significantly limited and the person can only move the hand to the level of the hip joint, then it can be concluded that the muscle fibers of the infraspinatus muscle are sharply shortened and contain trigger points that can be easily detected by exerting mechanical pressure on their typical locations, for example, using a massage ball against a wall. At home, you can reduce the intensity of pain or eliminate it completely by strongly affecting trigger points with subsequent muscle stretching. While rolling your body on a large massage roller, pay special attention to the shoulder blade area and roll both the right and left sides of the chest for several minutes. Then take a small 8 cm massage ball, go to the wall with it, find your shoulder blade, determine the spine of the scapula and the area of the infraspinatus fossa, and roll the infraspinatus muscle. Having found areas of compaction and increased pain, stop and press hard on them for 1 or 2 minutes. After that, work with the opposite muscle in the same way. An even more intense effect on problem areas of the muscle can be exerted on the floor under the weight of your own body. Since the main functions of the infraspinatus muscle are external rotation of the shoulder, shoulder abduction with external rotation and horizontal shoulder abduction, it can be stretched using exercises that perform internal rotation of the shoulder with shoulder adduction or horizontal shoulder adduction. In my training programs, you may have seen an exercise in which the hands are placed in front of the chest, the palms are pressed to the floor, and then the weight of the body is applied to the hands. This exercise, called the dragonfly pose, helps to perform horizontal adduction of the shoulder with internal rotation and stretch the infraspinatus muscle. To stretch the infraspinatus muscle, you can also use the following exercise. Sit on the floor, bend your knees, and place your feet hip-width apart. Then place the backs of your hands on the sides of the body, preventing them from sliding toward the navel. Place your elbows between your legs and apply very gentle pressure to your hands with your legs with each exhalation, relaxing the muscles more and more and stretching them. Another very effective exercise for stretching the infraspinatus muscle is the hand grip behind the back. It can be done either standing or sitting on your heels. One hand is placed on top, the other hand is placed on the bottom. We try to stretch our fingers as close as possible towards each other, ideally grabbing one hand with the other in a wrist lock. If you have a pronounced limitation of mobility, and you can put your hand behind your back, for example, only at the level of the waist, then use a belt or a yoga loop or even a sock. Grab the ends with your hands and try to gradually move your hands closer to each other. The fixation phase of all the exercises described above is 1 to 2 minutes against the background of deep and calm breathing through the nose. Stretching can be done under a stream of warm shower, and after stretching, additionally apply a heating pad to the shoulder blade area. In addition to regularly performing therapeutic exercises, special attention should be paid to the position during sleep. When lying on the healthy side, an additional pillow should be placed under the arm, which will limit excessive stretching of the infraspinatus muscle. If you have a problematic infraspinatus muscle, also avoid long static or regularly repeated dynamic positions when the arms are raised above the head, for example, when painting ceilings or playing tennis, as well as positions in which the shoulder is fixed in a position of external rotation for a long time, for example, during many hours of driving a truck with a large steering wheel, or while working at a computer when the mouse is positioned far to the side. Thank you for watching this video. In addition to the supraspinatus and infraspinatus muscles, arm pain can also be caused by problematic scalene muscles, a detailed review of which you will find in this video. Stay healthy and see you in the next videos.